Are you connecting this one to the Zoom?
No. Hello, good afternoon, everyone.
Very good afternoon.
Good afternoon.
Good. I guess you can hear me now.
Yes, we can.
Good. Yes, you are most welcome to our fifth edition of our mental health virtual series. And today we have an interesting topic to discuss. And once again, you are all most welcome. The topic is quite interesting that I am afraid that we might not have enough time, and we might definitely look for a version 2, but all the same, we need to get this one going. For today, we are looking at sleep problems, mental health, and well-being, and we'll be talking to the experts to throw more light on what sleep is. Those of you who can speak Akan, in Ponifosi, we want our experts to explain what sleep is. And to start, let's share a few housekeeping rules that we usually do. I would please ask of you to switch off your microphones, and I think that it's much better now. And when it is question time, as usual, you raise your hand and I'll ask you to give your question or share your perspective. We'll be discussing mental health, so as usual, it's sensitive. So I'll ask you to be sensitive in your comments and questions. This, we'll be talking to the experts, and we've put together, as usual, experts who are good in academia as well as in practice. As usual, we have with us our Chief Executive, Professor Kwesi Osei. I mean, you all know him. He's been a chief psychiatrist for so many years, have at least transformed mental health to this stage that it is now. So the little I say about him, you know. In addition to him, we have Dr. Yao Mfojo. A bit about him, Dr. Yao Mfojo has 24 years of work experience in clinical practice and management in general medicine, sleep medicine, psychiatry in both the private and public healthcare sector, including many years in South Africa as a consultant psychiatrist with the Department of Correctional Services, a product physician at Pfizer South Africa, managing Benoni Sleep Center in Johannesburg. Currently, Dr. Mfojo works with the Brain Clinic Limited in Accra here and acts as a consultant psychiatrist at Leicester and Legon Hospital. He also provides services to Lancaster University Ghana, University of Ghana Legon, Ghana Ports and Harbors Authority, and the local US Embassy staff. We also have Dr. Erica Damfrikwa Dixon. Currently, she is a physician clinical psychologist, head of psychology, therapy, and wellness department at the 37 Military Hospital, the immediate past national president of the Ghana Psychological Association. As always, I'll be your moderator. My name is Dr. Yao Amankwata, head for mental health promotion at the Mental Health Authority. And this is the format that we'll be using today. Prof would welcome us. Then, when he's done, Dr. Erica Dixon would give her presentation, followed by Dr. Mfojo. Thereafter, I would ask a few questions. I would ask a few questions and allow participants to also ask their questions. So, Prof, if you can hear me, you have the floor to welcome us to today's program.
Yeah, thank you very much, Dr. Arthur. And a very good afternoon to you all. Dr. Mfojo, Nana Juna, and Dr. Erica Dixon, and all the participants here. And I see 85 of you, and I'm sure more will be coming. So as it's been said, this is our 5th in the series, and obviously we'll be continuing. Yes, sleep is a major issue, and many people may not even realize it's a problem, even when they are going through. And once you don't recognize it and you are suffering better commerce, the consequences are many. And that is why we have thought, and this also includes your own comments in the course of the time that we'll be making these presentations, that these are topics that you want us to treat. So we thought it wise that now we will be discussing that. And as we've introduced our panelists, are experts in this area. So yes, we are all invited to be attentive, to participate, and to interact, so that at the end of the day, we'll all go home wiser than we came, and we also have something to share with others. I just want to say that I will need to leave at about 10 to 1 as I have another presentation to make. So whatever contributions I will be able to make, I'll make before that time. So thank you very much. You're all welcome once again. Thank you.
Thank you very much, Professor Akwesiose. Our time is very limited. I see Dr. Erickson is sharing her screen already. Dr. Erickson, can you hear me? Hello, Dr. Erickson.
Yes, hello.
Good.
Hello,
Good.
I can hear you.
Good to see you again.
Good to see you too. Thank you for the invitation.
Yes.
And I guess you're calling my
welcome.
name means that I can fly.
Please, the audience are eager and ready to listen to you.
Thank you very much. Thank you, Prof. And welcome to our participants. We've been tasked, and when I say we, myself and Dr. Mfojo have been tasked to talk to you or discuss or lead a discussion on the issue of sleep. And I hope I would be able to speak normal English so that we all get it and would open the doors for us to be able to ask questions, share our experiences, and we'll all leave the table more knowledgeable. So this is going to be very brief, a few slides that would guide my presentation on the topic. We need to recognize that sleep is a very important part of us, and it is necessary for our complete well-being, our health. We know that the WHO has established that health is not merely the absence of disease, but a complete state of physical, mental, and social well-being. And sleep is that one thing that when we don't get enough of can affect all of these dimensions. So it's something to be taken seriously. We spend about a third of our lives sleeping. I know that the life expectancy of your average Ghanaian is about 64 years or so. And it means that we'll be spending 21 years of that life span asleep. So it should tell you how big it is, how important it is. The brain has its own complex control systems, and I know that Dr. Mfojo would touch on this. He is a sleep expert. And therefore, the lack of sleep has a way of negatively affecting all of these dimensions that I have already mentioned that are important for the well-being. Indeed, one can survive going without food longer than you survive not sleeping away. So it means that sleep is necessary for our body to move it along. And if you do not sleep for about 10, 11, or 12 days, less than you would with food, you could pass on because of lack of sleep. We survive longer with sleep than we do with food. And most adults will sleep about 7 to 9 hours to feel properly rested. Now, we know that as children, newborn babies sleep almost throughout the day. They have about 16 hours of sleep. And this reduces as we grow older. In fact, people who are aged may even need much less than the 7 hours that adults are expected to have, possibly because the activity level is slowed down and we do not get as tired as we do in our very active years. So it's necessary for us to maintain our sleep if we want to keep our sanity, if we want to keep our health, and if we want to keep good quality of life. Sleep is important. And sometimes people wonder, so what is that? Sleep, unlike coma and anesthesia, or when you have been put under for surgery, is that state that you have some level of reduced consciousness and reduced mobility, reduced awareness, and even reduced responsiveness. And yet it is very quickly reversible. Somebody touches you, somebody shakes you, even somebody mentions your name, depending on the depth of the sleep, you could wake up. So it is reversible, not like when you are in a coma and you can't be woken up just by shaking you or touching you. Now, ideally, it takes about 10 to 15 minutes before one would fall asleep or get into that sleep state. What makes us sleep depends on certain factors. Some are internal, some are external. We all have within us some kind of a clock, an internal clock that is called the circadian rhythm that sort of regulates us. And I'm sure that most of us may be very aware of how this works with us. I am an early sleeper, and usually between 9:30 at West, I am gone. And 3:34, I'm awake. And I don't need an alarm clock to wake me or put me to bed. So this is how it is. There's that internal clock, and you'll be amazed that even when you have traveled into another time zone, it still may wake you up around that same time that you normally would have woken up when you are home. These are regulated by certain, should I say, for lay understanding, chemicals in our brain. So during the day, there's a buildup, and then during the night, there are other chemicals that do take over. But whilst we sleep, there are all sort of hormonal releases. Growth hormone is released, follicle stimulating hormone is released, luteinizing hormone is released. These latter two are reproductive hormones. And so we need the sleep for the body to do this kind of, if you like, repair work, to make the body rejuvenate, repair things that may have gone askew, and to keep us on course. Environmentally, the changes in light also does help in making us know, or making our system recognize that it is night, it's time to sleep. And so in this current world where we are faced with always viewing gadgets that come with so much light, and some of us have the bad habit of having big screens in our bedrooms, we lie in our bed and we're watching TV, or we're on our computer watching Netflix and so on, or even on our phones. these lights trick our brain and doesn't make it recognize that it is night and it is therefore time to go to bed. And so it could be really unhelpful for us. It's bad sleep hygiene to keep these gadgets on. The understanding that we have of sleep, indeed, research is still ongoing, but there's this young gentleman, a 14-year-old, and his friend who decided to do some kind of an experiment. And the experiment was to stay awake as long as they could. And indeed, this gave some insight that sleep is necessary, because if we do not, it affects so many things. He realized that by day 2, he couldn't really keep his focus on whatever he was doing. His mood was affected and he became very uncoordinated. And then by the time he was ending this experiment of not sleeping, he had started getting hallucinations. He was all paranoid. He couldn't recall. So from this young gentleman alone, and from other studies that have been done, it has become clear that not having good sleep may not just wear you out, but may do other more serious things to you that may not be good for your well-being. And so if you look at this picture, it gives us some of the ideas of what sort of things would happen. It definitely does affect your brain. Your cognition is affected. You can't recall, you can't focus properly. Your concentration is all over the place. It does affect the brain and its function. So your performance, your decision-making, all of these are affected. And so if you are a student, for example, and you would go on days cramming in the night so that you write your exams, you may be doing counterproductive work, because there is a time and season for everything. And staying up all night and depriving yourself from sleep all night would not be productive for you in that examination, because recall will become a problem. Your memory may get all messed up. Your focus may not be that good. You are not as sharp as you could possibly be. Besides that, it can affect your heart. All kinds of cardiovascular diseases have been shown to be caused with people who do not have adequate sleep. Your blood pressure could rise, and we know that hypertension comes with the repercussion of other situations or conditions or other diseases to the heart. And cardiovascular problems include stroke. It's been found that more than twice the risk is ascribed to people who do not have adequate sleep. So if you don't sleep properly, you increase your risk of getting strokes. Additionally, it does affect your immunity. So if you don't have good sleep, your immune system can be impacted. And especially in these times where COVID is so rife and we are all afraid, if you're not sleeping properly and your immune system goes down, you could catch any illness at all that comes your way. It affects our mood. So you could get depressed and you could also get very anxious. When we sleep, our metabolism is aided. And so when you do not have adequate sleep, you may find yourself gaining more weight than is necessary. Studies have also shown it increases your risk to getting diabetes, and your skin even begins to age. So you don't have that clear, fresh skin that you wish for. Indeed, it can lead to death. So all these things tell us that our sleep is essential, and we should not deprive ourselves of sleep, lest we get inattentive and not focused. And imagine that you are not attentive, especially for those who drive, for example, long distance. If there are not more than one who are driving and one person is taking a rest or sleep, you find that one person is driving such long distance through the night maybe that is part of the accidents that we are seeing on our roads. So these have practical implications for our life and living. Those who operate machinery, if they do not sleep adequately, may end up injuring themselves. If you are cutting or sawing something, you end up sawing your hands as well. These are injuries that we can't afford to have. But if you are not sleeping adequately, these can happen. It makes it difficult to retain information, and your decision-making becomes extremely poor. Our sleep is essential for our memory formation, for our recall, both long and short term. And so these are the benefits that we would get from having adequate sleep. How does it affect our well-being? If you don't sleep properly, you find that you are always tired. You are fatigued. You don't have the kind of energy that you need to have your day driven. I told you it affects weight problem. And so you may get obesity, and obesity is a risk factor for so many diseases, including cancers, heart diseases, kidney diseases, high blood pressure, diabetes, strokes, and the reduced immunity that I talked about. It also leaves you very irritable, and you may just have a low mood or actually present with clinical depression, anxiety, and your performance suffers both at work or at school, and especially for things like driving, and even your social functioning becomes muddied simply because you are not having adequate sleep. Our sleep affects our mental well-being, and so does our mental well-being affect our sleep. So in some situations, you would find that some people are not sleeping well because of other reasons, and sleep can be affected because of various reasons. Even just having financial problems or having challenges at work doesn't necessarily mean that you have a mental illness. But if it goes on for long, it can become that trigger that pushes you into a mental, if you have a predisposition into having a mental disorder. So it becomes the chicken and the egg. Sometimes you're not even so sure which one started first. There are a lot of mental disorders which symptoms present, especially with sleep difficulties. So when you look at the mood disorders, depression, most people who are depressed have difficulty sleeping, either falling asleep or that they wake up so many times while they are supposed to be sleeping. And the same for people who have bipolar disorder. They may stay awake for so long. Some depressives just don't even want to get to bed, out of bed. They just sleep and sleep and sleep. Anxiety is also one of those mental disorders that may present with sleep difficulty because the person is afraid. And then attention deficit hyperactive disorder, and many other mental health disorders. So we need to sleep to be able to reduce our stress levels, to be able to improve our mood, to be able to maintain our weight, to keep attention and focus and good decision making and judgment and our reaction time all in the bid to be able to perform better, whether in school, academic, or in work, in the workspace. It also increases our capacity for creative thinking, for even language learning, that those who have good sleep are better able to pick on their language skills, to make good inferential judgment, and generally to process your emotions better. You need to have good sleep. And I'm sure we know that some people don't sleep well, and then when they wake up, they're extremely cranky. At least we see these things. So for these reasons, it's important that we work at having good sleep. One of the things that helps us sleep properly is physical activity. If you are physically active, if you exercise, it's not simply good for your physical health. It's not just because you want to lose weight or maintain weight, but it also is very necessary for your sleep. It makes you sleep better. That said, if you exercise too close to bedtime, sometimes it can leave you so wide awake. So you need to be cautious about that. Keeping good sleep hygiene is important. And by sleep hygiene, I mean those things that you need to do to maintain your regular sleep wake, your regular internal clock going. So you need to keep a regular sleep and wake time. Some of us, our lives are such that things are always so erratic. We are not sure what time we go to bed. There's no real point in time we go to bed. It's just us and when and how it happens. It just happens to us. So you should work at having regular times that you go to bed and regular times that you wake for that internal clock to be properly set. Where we sleep also does matter, that you have a created space for sleeping. So within your bedroom, it is that space for sleeping. And I thought to add for sex before people charge at me that there are other things that are permitted within the bedroom. But do not make the bedroom that place where you eat your food, where you do other activities, or that it becomes your living room, because then your system doesn't recognize that shift. And recognizing that shift is important. Keeping your lights on at night, especially when you're having difficulty sleeping, is not particularly helpful. Remember, we said that besides that internal clock, it falls on the fact that it's night time, and then melatonin starts producing and so on, and then you are able to sleep. So if the lights are on, and by lights, I include lights that are coming from our gadgets, you need to cut off all those sources of light, as well as the distractions. Distractions could be anything, and some of us sleep with our beds, have clothes on half side, and then you are on one side, or your laptop on one side, and you are lying on the other side. These are too distracting and not good for the environmental cues that are needed to keep you sleeping. So it's best to go to bed between the 8 and 12 a.m. at worst, so that you'll be able to get that deep sleep that rejuvenates you. You may have to do some lifestyle changes if your sleep is not going well. For those who drink a lot of coffee, it has the potential to keep you wide awake. And in fact, some people take coffee for that reason. They want to work, they want to stay up, and they take that. But if it becomes the constant thing and you are always not resting or not getting the adequate sleep, it can come and bite you. So you'd rather stay away from that. The use of cigarettes or nicotine, and nicotine, some people chew the tobacco. So whichever means, nicotine is also one of those things that would keep you on edge. And then alcohol. Yes, people think that when you take alcohol, it knocks you off to sleep. Initially, it is depressing, so it lets you sleep. But later on, when it's a continuous problem, it's one of those things that can keep you wide awake if you are not controlled in your alcohol use. Using relaxation techniques, you can be able to put yourself better to sleep, because the system that is on edge, at the end of the day, you are able to shut that system down by doing things like meditation or guided imagery. Guided imagery is putting some pleasant picture or video in mind and going through that, and you realize that it calms you and you are able to sleep. Doing deep muscle exercises would help you, the system, calm down. And so some of these techniques can calm the system down, shut the system down, and you are better able to sleep. But above all, if you realize that you are having a problem with sleep, seek professional help. See a practitioner so that you are properly assessed for the reason for which you can't sleep. Unfortunately, in our context, people would go to the pharmacy and say, I want a sleeping pill. And sad to say, they are able to buy even medications that should be prescription only. If you set yourself off like that, you disturb that circadian rhythm that you have. it becomes even more difficult to fall asleep. And so you are more or less hooked on the medication, and until you take some pill, you are not able to sleep. These are things that we need to be cautious about, because having difficulty sleeping does not necessarily mean that it's stress. It's not only stress that can do that. Sometimes some people even have shift workers. So they are in night shift for such long periods of time that when they now get into normal working mode, that system or that clock is upset, and it takes a bit before they fall into normal rhythm. So let us take note of this. But as far as psychological health is concerned, when we do assess you and we find that what is going on with you has nothing biological, has no biological origins to be the reason that your sleep is upset, therapy can be given. And cognitive behavioral therapy is one of the therapies that have been shown to work with people who have sleep disturbances. So on that note, I would bring mine to a halt. I know that Dr. Fojo has loads for you, and then we'll be happy to have that discussion following his presentation. Thank you very much. Dr.
Wow.
Arthur, you can take over from me.
Thank you very much, Dr. Dixon. That's quite a comprehensive detail provided in a short time as possible. But I mean, clearly, at this stage, you can all tell that sleep is very important. If we underestimated the importance of sleep in our lives, your presentation tells us that we need to take it very seriously because it affects our memory. And I mean, the description of the experiment, attempting not to sleep, and I can't imagine attempting not to sleep. And the results showed that we need to take sleep seriously. And it provided strategies that we could use, such as exercises, relaxation, and all that. Well, Dr. Fojo is also in here, the sleep expert, to also provide. But before Dr. Fojo comes in, Prof told us that he will be leaving us very soon. And so I think that I would allow him to also share his perspective before he does, because before he does, otherwise he would miss his turn. So Prof, if you can share a few words, we would have that, then you can leave us peacefully.
Yeah, thank you very much, Doc. But I think that let the presentation go on so I don't take the wind out of the sail. The rest of being, going over what might later be presented. So I think let it go on. If I have time later, fine. Otherwise, I'm sure that all that I would want to say will certainly be covered by the two distinguished speakers. Thank you. Go on.
Thank you very much for saving me time. Dr. Fojo.
Yes, sir. How are you?
Good to have you on board. We are excited to have you.
Okay. Can you hear me?
Yes,
okay.
We can hear you.
So can I load the presentation on the screen?
Yes, you can.
Okay.
You have 145 people eager to hear you.
Okay, I think that just to update, I'm doing some work at Eurocare right now, and that's where we do the main sleep studies right now. So just to update. Okay, so I think acknowledgement of where I got the information from, a lot of the reference material from my sleep mentor, Dr. Aishad Ibrahim, who happens to be the medical director at the London Sleep Center. And there's a textbook, a very good textbook, first edition of Sleep and Mental Illness, edited by the two authors below, and it's published by Cambridge University Press. It's a very good resource for sleep and mental illness. Okay, so just a brief background, and I'm sure the host has gone through a lot of it already. Now, just to get a bit more technical, this is the equipment that we use for assessing sleep, and we use it's a German company, Weinmann, and it is able to tell us a lot about the sleep. This is a computer outlook or printout of what we're looking at. We're looking at the brain leads, and then we're looking at the breathing. We're looking at polysomnograph basically means poly is many, somno is sleep, and so many graphs in sleep. So we're basically measuring all the things that are happening, your blood pressure, your pulse, your temperature, your muscle movements, etc. And all this together gives us a clearer idea of what exactly is happening in your sleep. Okay, so Dr. Dixon touched on a lot of this in her presentation, and of course also in the experiments, etc. that are done. But just to simplify, these are basics of life, and sleep is one of them. Sleep, and incidentally, I always ask the question, has anybody seen any baby that's born that's 2.5 kilos or whatever, growing as they are walking some people get to the height of 6'7", etc. But you never see anybody actively growing or putting on weight, because all this happens when we are growth hormone secreted during sleep, and growth activity happens in sleep. The other very important things, which basically nobody teaches us, God gives us for free: food for energy, water for thirst, sex for procreation and birth, mobility, which assists with all the above. Of course, when you take stuff in, you've got to remove, so excretion, and then we are born, we must die so that we make way for others. So these are basics of life, and sleep is one of the, I would say, sorry, this slide excludes being born, but these are the 8 basics of life that, regardless of your creed, your sex, God gives us all these things for free, and sleep is a very important basic amongst that. So just looking at international classification of sleep disorders, if we want to go to town, there are about 85 different sleep disorders, but broadly classified into 8 categories. And so we try to look at the insomnias. I saw a question on there about sleeping too much, which is, we've described them as more the hypersomnias. And the parasomnias are stuff that happens in parallel with sleep. So these with the 3 broad categories. I think Dr. Dixon has covered this, so we shall not labor too much definition. Okay, I think just to go into a bit more detail in terms of what we call the sleep architecture, and incidentally, there's something in sleep we call wakefulness. So when you actually analyze a sleep study, the wakefulness accounts for less than 5%, and non-rapid eye movement, and as the name suggests, the eyes are rapidly moving in a certain form of sleep. And so non-REM forms about 75 to 80% of sleep, and then REM sleep, which is rapid eye movement sleep, forms about 25%, 20 to 25%. And in non-REM, there are 1 to 4 stages, I suppose, depending on which approach you're using. Some people combine 3 and 4, and some people separate them. So again, in a normal PSG, REM sleep or non-REM sleep, regular, I'm sure that for those of us who remember our neurology, the EEGs, the sleep spindles, K complexes, slow waves, and in non-REM sleep, muscle tone is low, and there's minimal psychological activity. I think this distinction is very important, because dreaming is a psychological activity that happens in REM sleep. So in REM sleep, the EEG brain waves are irregular. It's almost like you're awake, and there's no muscle tone except the movement of the eyes, and that's a rapid eye movement, and the movement of the diaphragm, which basically keeps you breathing alive. And then dreaming is typical in REM sleep. I marvel when sometimes like Dr. Dixon, I'm an early morning riser and sometimes wake up at 4 a.m. Then you hear some pastors interpreting people's dreams and saying, meanwhile, they will say that, oh, this dream means this, but everybody dreams. I mean, sometimes we might not necessarily remember what we dream about, but the dreams are a normal part of our sleep activity. And so, and what you dream about, whether it's dead people or whatever, is actually then the content of what you're going through. So anyway, sleep disorders, again, normal sleep, stage 1, non-REM, counts about 2 to 5% of sleep. Stage 2, which is where the majority of sleep happens, 45 to 55% of sleep. That's why we have characterized by the sleep spindles and the K complexes. And then stage 3 and 4 combined, and that's where slow wave sleep, or that's what people typically describe as deep restful sleep, deep sleep. And that forms about 15 to 25% of sleep, depending on the age as well. Now, important, sleep always begins in non-REM stages. So stages 1, 2, 3, and 4. The first REM cycle appears about 80 to 100 minutes later. Non-REM sleep and REM sleep alternate roughly 90-minute cycles through the night. And there's a lot more non-REM concentrated in the first half of the night, and there's a lot more REM episodes prolonged in the second half of the night. That's exactly why also they will say for women, we have erections in the mornings, because erectional activity actually occurs during REM sleep, and also dreaming happens. So a lot more people will say, they remember their dreams because a lot more dreaming happens in the second part of the night, which is in REM sleep. Okay, so this is what we call a typical histogram in terms of looking at the different stages and the different hours of sleep. And incidentally, I suppose, I don't want to call it a myth, but it's almost like the teaching that we should have 8 hours sleep comes from a diagram like this, because it then accommodates the number of REM cycles in the night. But as you see later on, there are people who sleep slightly less, and there are people who sleep a lot more, which has its implications as well. Okay, so again, duration, less than 5 hours, short sleeper, not good. More than 5 hours, long sleeper, also not good. So average 7 to 8 hours as described. Dr. Dixon talked very lot about sleep hygiene, which incidentally, when anybody comes to you complaining about a sleep problem, the first thing you've got to ask the basic questions about sleep hygiene. I mean, with our technology world nowadays, people have all kinds of huge TV screens in their bedrooms. They do all kinds of things. They have gym sets in their bedrooms, etc. And then they come and complain about not sleeping. So it's important when you're assessing a patient or client that you ask these basic sleep hygiene questions. That's not to say, I mean, there are people who have all these things, who do all these things and still sleep like a baby, or still sleep nicely. So it's when someone has a problem, then you actually go into these, the basic sleep hygiene, finding out about these things before doing anything else. Also, some people nap during the day, but they don't necessarily want to consider that as part of the sleep. But again, for the need for sleep, it's the total sleep required in the 24 hours. So one of the things that for some people who you find out that they nap, just tell them, okay, try and avoid daytime naps. reduce your evening meals. And another thing that also affects people's sleep is the regular medications. And when I say regular, unfortunately, hypertension, diabetes, etc., then those medications have become almost like a daily thing for lots of people. And a lot of these medications do affect your sleep. Dr. Dixon also mentioned about good sex. In fact, my mentor always said to me, and she put it there, that the bedroom is for sleep and sex. And so one of the best ways to actually find out whether somebody is actually having a problem, sleep problem or not, is to find out how regular they are able to sleep after sex. Yeah, so that's a very simple question that we should all be asking. So just a few facts about sleep and normal aging. Okay, again, Dr. Dixon mentioned about babies. The important thing is that in newborns up to 2 years, 50% of their total sleep is REM sleep. That's why babies can get up anytime, feed, do whatever. And it's only after the REM sleep percentage declines to the normal of about 2025. That's when at 2 years, they say parents can say, oh, we can now start sleeping normally. Otherwise, especially the moms will have to be up or anytime, because the baby can get up and breastfeed anytime, etc. Slow wave sleep, again, important information. Slow wave sleep, which is deep sleep stages, decrease significantly across adolescents by 40% from preteen years. And incidentally, again, growth hormone is secreted in slow wave sleep. So we all know that at a certain stage, we stop whether growing tall or bones fuse, etc. Now, important that there's a link between that and growth hormone secretion. And in particular, there is a decline in the percentage of deep sleep, particularly more so men than women. And so that's why some older people will tell you, oh, but I slept, but it was light. I didn't feel like I missed that type of deep sleep that I used to have. But the fact of the matter is that that's a normal part of aging, growing up and aging. Mentioned that REM sleep decreases in percentage across childhood, adolescence to adulthood, in old age, except in dementia. Also, that's another tool for, I mean, it's not something that we do regularly, but there is an increased REM sleep percentage in certain dementias, and Parkinson's, etc., will be a good example. In fact, there's some association between Parkinson's disease and what we call non-REM sleep behavior disorders, but that's another topic for another day. So important decisions relevant to insomnia, and I'm sure just from doing sleep studies. So Dr. Dixon again mentioned sleep onset latency. That's the time you take from wakefulness to fall asleep, roughly normally about 20 minutes. TST will be the total sleep time, and that's very different from the time in bed, because you can actually be lying in bed and not asleep. And sleep efficiency, that's the total sleep time, total time in bed. Again, normal is about 85%. Some, again, deep sleep, slow wave, stage 3, and light sleep is more stage 1 and 2. So I'm sure that we've heard about the management of insomnia through the biopsychosocial model, and I think that Dr. Dixon also mentioned something about CBT. Again, a lot of the times insomnias are transient. That's difficulty in falling asleep or staying asleep. They're transient. You have to set realistic goals. It's one tool that we don't use that much, which we encourage people to use, is a sleep diary. By the time a patient will come and complain to you about something that might have happened the night before, give certain instructions. So a sleep diary, basically give them the diary to go and complete over a period. It's not just one night, but over a period, say 1 or 2 weeks. And that will give you, and this is not even, some of the sleep diets are quite simple. It's not looking at the time. It's just filling in simple basic information. And that will give you an idea of a trend that's going on, because sleep is not an event. It's usually a trend. Okay, so that usually helps a lot about tackling certain myths about sleep. Requesting a polysomnograph is not a cheap exercise, so you should try and you should try and manage with, preferably with a sleep diary. And also importantly, insomnia doesn't just disappear after just taking a pill. By the time the person comes to see you, the trend or whatever has been going on for some time. So the psychological aspect of getting back to a normal pattern is crucial, and not just popping a pill. Yeah. I think that, again, just relating sleep, especially to the practicalities of what we're seeing, sleep and breathing. So this is a normal airway, and this is someone whose airway is narrowed because of for whatever reason, but you can see the mechanical constriction, and this is going to lead to what we call an apneic episode, which is an apnea basically means you stop breathing. So this just, I think in the discussion presentation, Dr. Arthur asked me to talk about common problems associated with sleep. And incidentally, since we all now know that hypertension and diabetes are common problems, significant problems that are coming up, either related or sometimes either as a cause of hypertension and in particular, is what we call obstructive sleep apnea. And there's a simple mnemonic. It's called STOP, S-T-O-P, BANG, B-A-N-G. And it's actually, they've got a very nice website which gives certain basic things to look out for when somebody has sleep apnea. But basically, people stop breathing in their sleep, start gasping for air. I'm sure we've seen a couple of those. And it's also incidentally associated then with insomnia, which is then difficulty in falling asleep. And then there's major problems come up, daytime sleepiness, some of the things Dr. Dixon talked about, forgetfulness, impaired concentration, and very high risks of motor vehicle accidents. And sometimes you hear some of these, whether, I don't want to bash VIP, but some of these long distance, and then you hear, oh, and then they said the driver was, yes, we are gradually getting obese. We have high blood pressure. We don't check on these things, and sleep apnea is lurking right there. So management of sleep apnea, again, this is where you need, or it will be good to do an overnight sleep study and treat the comorbid conditions, lifestyle changes, weight loss, medical interventions, CPAP. Some people benefit from mandibular advancement, surgery, and then positional therapies. We shan't go into those for now. Another common problem, I think, or an incidentally, I'll say common problem, because sometime when we were growing up, they were saying narcolepsy wasn't that common, but I'm sorry, I've seen many, and so that's also another common or another problem associated with excessive sleeping. Again, narcolepsy is the typical representation of abnormal REM sleep happening when somebody is awake. So normally sleep happens in non-REM, but in narcolepsy, the person goes straight into REM sleep. So that's why, and in REM sleep, if we can remember, there's absence of muscle tone. That's why we have this, they call cataplexy or loss of muscle tone that is described narcolepsy. Narcolepsy is also associated with what they say with hypnagogic and hypnopompic hallucinations. It's basically just the person dreaming, and because dreams happen normally in REM sleep. So the vivid hallucinations that are being described are dream states. And narcolepsy also, there's something we call sleep paralysis. Again, noting that in REM sleep, there is very little muscle movement. In fact, if anything, sometimes I'm sure you've heard about people getting up and saying, I got up and I was stiff. I got up and I couldn't move, because they actually then woke up in REM sleep. Now, this is the opposite, where the person falls asleep while awake but goes straight into REM sleep. And also, so it's, again, the diagnosis is confirmed by doing a multi-sleep latency test, which is basically doing a couple of things, including overnight and during the first half of the day, just to see or demonstrate that the person actually falls asleep directly into REM sleep. So again, these are, and of course, in narcolepsy, there is a biological basis which is associated with the peptide orexin being absent in the cerebrospinal fluid of clients. Daytime sleepiness is treated with modafinil. Methylphenidate also works quite well. And then there's the GHB or Xyrem. The cataplexy is treated very well with SSRIs. I've had some very good experience with sertraline, and GHB Xyrem also helps with that as well. So, and again, just speaking a little bit about narcolepsy, a lot of people find it embarrassing, so they don't necessarily want to talk about it. I've looked after a couple of, about 2 or 3 people in the fairly high up in the security cluster or security services, and they struggle, or they manage to hide it away from their bosses for some time. Yeah, but yeah, because they just find it embarrassing. So let's go into the parasomnias, which are basically activities that happen in parallel with sleep. So this is where restless leg syndrome, periodic limb movement disorders, which are incidentally also a very significant cause of insomnia. And those 2 top conditions, in particular, restless leg, there's some interrelationship with, or there's some correlationship with iron deficiency anemia. So it's always best to or it's always useful to do iron studies in these patients. And there's an interesting condition, or a couple of reports that have happened, where sleep happens and where sleepwalking happens in stage 3 and 4. And then there was one particular case in I think in the UK, where then the person went to have sex, whatever, with somebody, then had no recollection extra. Then night terrors again happen in stage 3 and 4. That's because they are happening in non-REM sleep. The clients or the patients usually have very little to no recollection about like what actually has happened. Then there's the REM sleep behavior disorders, which incidentally also, for a number of people, it's almost like a prelude to the occurrence of Parkinson's disease, where you have all kinds of abnormal behaviors and movements, etc., in sleep, especially in the slightly older. And this, for a number of people, they actually progress to develop Parkinson's disease. Thank you very much. We don't like to speak ill of the dead, but I'm sure that at some stage we might have heard rumors about President Rawlings having Parkinson's and having and I remember that in my time in South Africa, he came for some sleep studies there, etc. But anyway, that's another story for another day. Yeah. Okay. Thank you very much for the opportunity to present, and I'm happy to answer any more questions. Any questions? Yeah.
Wow. Thank you, Dr. Mfojo. At least we've done, with your presentation and that of Dr. Dixon, we've done Sleep 101. We've all passed.
Hello, can you hear me?
Yes, I can hear you.
Yeah.
Can you hear me too?
Yes, I can. So do we wait for the questions or do we look at what is on the screen? Because there's one that I would like to address immediately, and that's something that we see very often about the use of the pam drugs, diazepam, lorazepam, in the treatment of sleep insomnia. Now, incidentally, the pam drugs, and diazepam being long acting, lorazepam being short acting, etc. What they do is they prolong the stage 2 sleep. They prolong non-REM stage 2 sleep at the expense of deep sleep. Because I mean, if you are subtracting something if you are adding something somewhere, you must be subtracting from somewhere. And so that's exactly also when after some time, they will tell you that they'll come and complain. They're like, oh, I slept, but it wasn't restful. Because the way in which the pam drugs work is to reduce the what do they call it? The quantity of deep restful sleep at the expense of extending stage 2 sleep to more than 55%. So you are taking something away. What do they call it for? So in using these medications, one also has to be aware of not only how they work, but the impact also eventually on what you're trying to treat.
All right, thank you, Dr. Mfojo. I guess that I would ask a few questions, and attendees should also ask theirs. My question, I think most people would ask the same question. I am currently sleeping for about 4 hours. I'm getting used to it. Should I be concerned?
Maybe Dr. Dixon like to answer that. But I mean, look, the sleep as well and enough for you to function. Okay. And function means many things. Your memory, your ability to, if you're a surgeon, ability to hold the knife. Function means many things. So in how much you're sleeping right now, again, you're saying 4 hours. Maybe it's a bit more, but once it has not begun to impact on your function, then what are you treating? You know, the other questions, then again, we all, a long time ago, we never used to talk about diabetes or hypertension because we felt it didn't happen to me or didn't happen. But these things are so common now, and they impact significantly on one's sleep. So, and of course, I mean, unfortunately, the link to obesity and all this kinds of. So, yeah, I wouldn't say be concerned or don't be concerned. I'll just say, has it impacted on your ability to host these meetings today? No. So then why create a problem when there's no problem?
Well, let's go further. It has not impacted in any way how I function. But you expect to tell us at my age I should be sleeping between 6 and 8 hours. So if I wake up and I check the time, I didn't get my 6 hours today. I've lost. So I've lost 2 hours of sleep. Anyway, when I get up, I get to work. But I was wishing I'll get my 6 to 8 hours. On other days, sometimes if I'm lucky, I get my 6 hours. But in most days, I get my 4 hours.
Mm-hmm.
So now, okay, in other
May I?
Yes, please.
Yes,
Yeah.
I think that, like Dr. Mfojo said, once you have noticed there is some change,
mm-hmm.
how is the change affecting your day-to-day functioning?
Mm-hmm.
So once there is some difference, and you realize that difference is causing some ripple in your life, and it depends on which aspect of your life is affecting. People around you, for example, may have noticed that Dr. Arthur is not a very nice person these days. He's so short-fused in the office, you know. So it may seem like you're doing okay, you are moving along, but are you? So you've got to look at the different all the areas: physically, mentally, socially. Are you functional? If you are not functional, and all of us who have reduced our sleep to 4 and 5 and so on, it's because of the hassles of living. If you live at where some live at Koforidua and come to Koforidua and work and work in Accra at ministries, you can't even afford that sleep. This is what has pushed us into having the 4 and 5, and of course our bodies seem like they have adjusted. But if you look critically, you realize that on days that you are able to do more and better, you are a more pleasant person to be around with. If you are not sure, I think that bottom line, where you find that your lack of sleep is disturbing anything, go speak with your practitioner. Be properly assessed. That's one thing that Ghanaians do not know how to do. We want it to be broken, and then we'll go to the hospital to fix it. Where there are slight changes, we consider it a waste of time, a waste of money. But if you go early and something can be done for you, it may not cost as much as it would cost you in the end. You know, so let's take these things into consideration and seek help when we realize that we need it.
Thank you very much. One other thing that you mentioned, thank you very much. Other thing that you mentioned was getting the room dark. But you know, our smartphones that we have now places us in a very tricky position. I would want you to emphasize on that.
Yeah.
Emphasize on that for workers and for students who are here, because we might be joking. I don't have TV in my bedroom. All the lights are off, but you will be trying to sleep and you hear the last noise. People, you have a test and you want to check, then you have light in the room. Now, well, I want you to.
Yes, I think that you started answering yourself in your asking the question. we said categorically, these artificial light sources trick your mind, you know, to feel like it's still daylight. It gets it confused. So it is best to put these phones away. And if you think it's going to be bleeping to wake you up, it's one of the distractors, the common distractors that we have. You may want to put it off. Or if you think you may need a phone for some emergencies, maybe get yourself some yam close by. But these smartphones with all these bright lights definitely don't do well in enhancing our sleep. Unfortunately, especially for the young group of people, their phones is always at arm's reach. And then they keep getting the bleeping noises. And of course, when the noises come, it comes with the light coming on also. So they are so distracted, the sleep is not full. You wake up not feeling rested. You may have been lying in bed for even 10 hours, but you wake up not feeling as rejuvenated as you must. So that's something that we should be very cautious about if we want good sleep and therefore good well-being. Roger.
All right, thank you very much. Dr. Mfojo,
yes, sir.
In one of your slides, you said that go to sleep only when you are tired. Can you explain that for me?
I think, again, with respect to, again, this is more geared towards someone who's complaining about a sleep problem, insomnia, extra. But so some people will then go and lie in bed and expect the sleep to come. So very soon what happens is their bed is now more or less, some people actually are afraid of going to their bed because they think that when they go and lie there, they will just lie there awake, waiting, etc. So one of the simple advice you give, you don't, to break that cycle, that pattern, you don't go and lie in bed while you are waiting for sleep to come. No, you rather wear yourself out, whatever, before you go. So that's just a simple advice that one could give for someone who has the particular challenge of, okay, I go and lie in bed and the sleep doesn't come. So that would be
okay. So the trick is to sit in your sofa and pretend that you don't want to sleep, and when you begin to feel sleepy, you go to bed. Is that it?
Well, people, it's not even that. I mean, some people read. I mean, people do all kinds of things as
you read with light.
Well, yes, but some people read until they feel sleep. They don't necessarily read in their bed. They read until they feel sleepy, then they go into bed to sleep. Some people have good sex and they wear themselves out until they fall asleep. So it really is a matter, it's more of, like I said, in particular, this advice is directed at those who have the peculiar problem of associating their bed space with inability to sleep. And there are quite a number of people like that. Yeah.
And if I must add, when you are unable to sleep, or when you're already having a challenge with sleep, like Dr. Mfojo said, and you go and lie in your bed, that anxiety of waiting, all right, so is the sleep coming? Is today going to be the day that I don't sleep, and so on? You heighten your distress. And when we are all stressed like that, or you are so tuned up, really, it's difficult to fall asleep. So it is better to wait, do other things. And when you feel tired and feel like you want to go to sleep, then you go and get yourself prepared to sleep. And then there are those who also sit behind their TV, and those in aliquots, in little pieces. And by the time they say they are ready to go to bed, the sleep is now gone, more or less. But they've had so much sleep already. The person, they have slept 3 hours, say from 7 p.m. when they were listening to news until whenever. And then now they wake up, go and have their bath, and then they want to go and sleep. That distraction or that disruption has caused some shift. So they may also come and complain that they are unable to sleep. You may even find that during the day, they've been napping in bits and bits, and all put together, sometimes comes to that 6 hours. But when it comes to night and sleeping, they and their beds are not particularly friends. So there are different categories of people and how the sleep disrupts for them.
Okay, at this point, I will allow participants to also ask this, because if I can engage you with a lot of questions, but I'll allow participants to ask this. The first person whose hand I see is Advocate Wabing.
Yes, Dr. Good. Yes, good afternoon to everyone, my senior colleagues and my colleagues as well. My question are in two bits. The first one is, what advice would you give? I'm a new nurse. I'm a newly qualified nurse, and I've just started working, and I don't have that experience that other colleagues have in terms of our shift system, because I'll be doing night, I'll be running day and all of that. So what would you advise health professionals to do because we are talking about sleep and how we can take care of ourselves in that regard. Secondly, because Dr. Fojo is into, I think, a research, how does, if we have a research on sleep and all other things in Ghana, how does it feed into policy development in terms of Dr. I'm forgetting the madam, I'm forgetting the name right now. She was Dr. Dixon, yeah. She was talking about you traveling from Kasua to Accra and all of that. How can this feed into policy development for housing, for transportation, for all of this, and maybe mental health in general? Because I think policy makers don't really give a hook about anything that maybe we do or we research and we come up with it that would even help their policy formulation. So if you could say something about it, I'll be glad. Thank you.
All right, thank you, Babin. I think that Dr. Nfojo will take the first question with regards to night shift and how you need to prepare your body and all that, and Dr. Dixon will take the other one.
Or the other way around.
The other way, I think it should be the other way around.
Yes.
The other way
Yes.
around, because he asked
Yes.
directly Dr. Fojo about his research.
Yeah.
All right. So the
Okay.
issue about shift working, I mean, it is clear that working shifts has a way of disrupting sleep. Within the health system, I think nurses, for example, get you do night shifts, and after night shifts, you are given off days, because that awareness is there that when you are not, when you keep doing night shifts, it causes disruptions for you. So then at least you have some days in between where you gradually adjust. And normally you wouldn't be given 1 full month, say, of night shifts. Unfortunately, again, because of life and living, some people would ask to be on night shifts for a year or two because they are doing programs. These obviously get detrimental, but you are buying something to take something, you know, regularly, that's not how it would have been arranged for you. But you have chosen, it is a choice you have made, that irrespective of the fact that it could affect your sleep, you need the time more to do your work or to do school. So you choose to take nights on end on shift. Definitely when that period is over, making the adjustments becomes an issue, and it takes a couple of, it takes some time. People vary before you adjust to the normal sleep mode that you were in before. I have ever attended to a gentleman who was, I think, in his 60s then. He had been a night watchman for 15 long years. And so now he was no longer working, and he realized that he's never able to sleep in the night. So shift work can affect your sleep pattern. And so those who are in HR should take this into cognizance in arranging how often you go on these shifts, so that everybody has a turn and then you don't fall into a bad pattern or habit. Roger.
Yeah. Thank you very much for the question. In terms of how whether information and research or information should influence our policy, unfortunately, that's not happening. I mean, I cannot say that I do research. You know, I'm fortunate enough to have access to some data, but I would have loved to be able to do a lot more structured research. But definitely, there's a need for some of these basic things to and they are basic, because I mean, when you look at, again, the incidence of diabetes and hypertension in particular, and obesity in our country, there's, I mean, having a sleep assessment should be something that should be almost routine as well, because I mean, I'm again just giving an example. I know someone who eventually suffered what they call renal failure, but it started as an obstructive sleep apnea, and then it then progressed to hypertension, and then before they realized they were not treating the stuff, and they then developed kidney failure. So there are all these unfortunate or interlinkages with our lifestyles, our sleep, these common illnesses, which should be feeding into our policy. I mean, what is the position of the GPRT, for instance, to assessing their drivers, extra about some of these basic things that impact on motor vehicle accidents, extra. So yes, there definitely needs to be a more concerted effort for some of this information to feed into policy, and we do hope that we'll get there soon.
All right. Thank you, Dr. Fujo. Dejani, you have the floor to ask your question.
Dr. Fujo, Dr. Dixon, thank you very much. I think this presentation has come in time. My wife joined me, and she's benefited a lot from it because she's been having these sleep issues, and I'm a mental health nurse, and for some time now I've been trying to help her in my own way with my knowledge and expertise. But I think this presentation has been very helpful. Now, coming to my question, I realized that sometimes I wake up with very severe headache, and I've realized it's mostly associated with dreams that I will call adventurous, for lack of better description. And if I say adventurous, I mean dreams where I'm being chased and I have to run away. I have to hide from those chasing me, and usually it occurs like that, and I wake up with very severe headache. I have monitored it consistently, and that is what happens. Of course, I wake up from other dreams, but usually when the dreams occur in this way, I wake up and I have severe headache. So I want an explanation as to the association or the relationship between such so-called dreams and then this headache that I wake up with.
All right, thank you very much, Johnny. I guess Dr. Fujo will speak next.
What can I say in response to that? Yes, you've given some very interesting, important symptoms, but like every assessment or clocking or whatever, the information is still very incomplete. So to sit here and say that, then based on that we can just pull an answer and so that would be most unrealistic and unfair to you. So as Dr. Dixon suggested, I think that it would be good to make some time and yeah, there are many questions to ask, age, blood pressure. There are just so many, to do a fair and full assessment of what the challenge might be. It would be unfair to think that we can just provide an answer. No, unfortunately not.
Yeah, I mean, one of the first things that was going on through my mind when you said that was, have you ever checked your blood pressure since you are a health person? So I do agree with Dr. Mfojo. This is too big a platform to start engaging you on detailed questions to kind of try to assess what the possibilities could be. I think that as a people, we are quite mean to ourselves. I say mean to ourselves that if you ever had a slight noise in your car, the next day you are going to the mechanic, But for ourselves, we're so unkind, we would not go to the hospital. You are more important than the gadgets that you use. So give yourself some attention also. And by the way, health professionals, we are the worst when it comes to healthcare. Instead of going to do the right thing or seeing your colleague to be assessed, you would, oh, this one, and then you are taking care of other people. What if you collapse taking care of another person? How fair would you have been to yourself? So please take these into consideration. Know that you matter as much as your patient. Go do the right thing, get yourself assessed, and get that problem solved, okay?
All right, thank you, Dr. Erickson. But to add to that, okay, so let me add a follow-up question. Now, I want to seek professional help. What things over the period, what things do I need to take particular attention so that when I come, I'll be able to provide you with enough information to be able to do a better assessment of my problem?
You ask again. You ask me a question. I think that I will reflect or refer to the beginning of my presentation. I said that sleep is a normal activity, but it also is in balance or in whatever with other things that are going on in our lives. So, I mean, to have almost like a laundry checklist of the stuff that you you might, and come and present. No, I think it's again, it's more of, okay, like you, for example, said earlier on that nowadays you are doing 4 hours, but occasionally you do 6 hours. I mean, it would be interesting to, for example, to get you to fill a sleep diary over a week to see, because that will then whether help us understand your issues a lot better. And a lot of the times, and I'll be very honest, a lot of the times people come and complain, and when you do a sleep diary, you say, oh, you discover so, but then you find out that really there's not particularly a sleep problem per se, and we all go through these challenges here and there. And so sometimes I tell people who don't like to hear this, but I say, no, we don't have to create a problem when there's no when there's no problem. And I unfortunately also, when people come and see you, they expect you to prescribe medication for them, and I say, oh no, but I'm sorry, I can't. I do not see the need to prescribe. And some people will get upset. But I mean, the point is by the time
no medicine is no treatment.
No, you see, but unfortunately, the treatment could be a simple change in even your dietary. Yeah, exactly. And we have to be patient enough to give that understanding and explanation. Yeah.
I think that as individuals, we need to be observant also. If we pay attention to ourselves, we may be able to give better information to the practitioner who is wanting to assess.
Exactly.
Which means that you should have observed a certain pattern. I was sleeping excellently until I noticed this change over this period of time. Were there any change in situations around? I mean, for example, if you reported to Dr. Mfojo or myself that, oh, my husband died a month ago, and since then I haven't been able to sleep well, it is pretty much obvious. There is a distress that has come in, most likely the reason, and therefore you may have to be observed a bit, go into therapy to see if you're adjusting properly to the loss that you have, and so, and that may be all that you need. You don't particularly need medication. Indeed, if you are bereaved and you are mourning and that's why you are not able to sleep, for example, why should anyone prescribe medication for you? Medication shouldn't be the first thing, the go-to. There are other things, simple, seemingly unimportant things that you do, including putting off the lights in the room, putting off your gadgets, all these things, and you find that, oh, there wasn't any disorder or disease or anything. It's just these things that have become distracting. But yes, be observant of your patterns and lifestyles and how they relate to these changes. once you have these, you'll be able to give better information to the practitioner. Are you snoring, for example? And I think Dr. Fojo has mentioned certain situations that could let you have your sleep really disturbed, or you wake up feeling very unrested because there's some obstruction and so on and so forth. If you don't realize it yourself, people who you are in bed with, or the person you are in bed with, should be able to let you know, oh, you snore quite a bit and so on. And you take note of all these things so that you are able to report them appropriately to the practitioner. Or if you don't report them, they will be asking you. So if you have noted these things, it comes in handy.
All right. Thank you very much, Dr.
Thank
Dixon.
you.
Zara. Hello, Zara. Zara Abba. Okay, Zara is not ready. Prince.
Hello. Hello, this is Zara.
Okay.
Hello.
Hello, good afternoon. My question is related to the waking up period. So I've noticed that all things being equal, when I have just my normal 7 to 8 hours of sleep, sometimes when I wake up, I feel well rested. But when I wake up in the middle of a dream, I wake up feeling tired, any kind of dream. So I just wonder, is the problem waking up at the wrong phase of the sleep cycle? Thank you.
Gee, how do we
Thank you for the question.
how do we answer this particular one without getting
I
lost?
guess it's similar to the one from
Yeah, but apart from that, again, importantly, so because I always like to, how has this affected your functioning during the day? I mean, are there any, do you notice any difference? I mean, I'm just trying to relate what you might be going on, what might be going on to something that then impacts on your work, your life, what you do, etc. So that's because, you know, we dream a lot more than we like to think or accept. I mean, a lot of the times we don't necessarily remember what we dream about. But to say then that because then you woke up in your dream, there are many dreams that happen which we just don't necessarily recollect immediately, but it doesn't mean that they haven't happened, because dreaming is an essential part of sleep and psychological recovery of memories, etc. So I again, I think that this is a interesting question, but we need to find out a lot more about how it actually then impacts on your life.
All right, thank you. Prince, you have the floor.
Okay, thank you very much. My question ties to the first one concerning the shift system. And I'd like to know, I have been doing some readings about, and I came across this solution that called phototherapy. I want to know if that really works, because they are saying there are these lamps that when you put it aside your bed or you read alongside with it, it can shift or correct your sleep system before you go for a shift that particular day. So I want to know if these things really work, or they are just there for commercial purposes to take away our money. Thank you.
Yeah, I think that we again, we didn't go into too much detail about the interrelationship between I've forgotten the name of this chemical just now, sleep, but
melatonin,
sleep, light, extra. I mean, it's just an interesting interaction, and again, that's part of this whole, and just going into detail, phase shift when you travel, jet lag, extra. But to then almost yes, light does play a certain role in sleep, but it is more natural light. than, than artificial. It's more natural light than natural sunlight than artificial. Yeah. So I don't think that it will necessarily help, in terms of, again, what is the particular problem you are complaining about? Because you've not been, very specific about. You get me? I mean, you've mentioned possibility of using light for something, but what is there a problem? What is the problem that you are worried about?
Prince, yes, phototherapy. In terms of shift workers, I'm not so certain because I don't have that experience. However, some people who have difficulty sleeping because they have things like depression, okay, which is another quite a common mental health disorder. Sometimes that has been found to be helpful for some, especially the type of depression that is associated to changing seasons, which is not something that we really get here, because in the West, you have winter, long periods of darkness and so on. And it's been shown to be helpful to some people. As far as shifts are concerned, I do not know, but I know that it's been helpful to this group of people. Maybe it will help, maybe it won't help. You could always try it out and see. And I'm assuming that your issue was that you do the shift system and your sleep becomes a little messed up and you're wondering whether the phototherapy would be able to help. I haven't seen much data that kind of cringes at that, yes. So I'm confident, same as Dr. Fojo, that yes, it does it. But for some cases of seasonal affective disorder, which is a kind of depression, it has been shown to help.
All right.
So I hope it's helpful somehow.
I guess, Prince, you find that helpful. All right, Jacob. Hello, Jacob.
Jacob, please unmute.
Jacob, unmute yourself. And your line is very bad.
Yeah. Maybe if Jacob typed it, we will be able to get it.
Yes. Jacob. We are not hearing Jacob. Let me try Daniel. Jacob, we are not hearing you at all. Let me try Daniel. Hello, Daniel. Hello, Daniel.
Yes, can you hear me? Can you hear
yes,
me?
We can hear you. Go ahead.
Yes.
Yes,
Yeah.
we can.
Yeah, good afternoon, and thank you so much for the interesting presentation and the discussion. My question is simple. I think it has been touched earlier, but I want a different dimension. I also don't sleep, sometimes maybe 2 hours. I haven't seen any serious effect on my functioning ability. Do I have to wait to be seeing some more functioning in what I do before I seek for help? Thank you. Over.
No, I don't think necessarily you need to wait for malfunction before you need to seek for help. But in terms of, again, I asked the question, okay, you come to, for example, okay, this your 2 or 3 hours. When did it start? How old are you? What has changed? No, there are so many parameters beyond just that. One would say that the complaint of the number of hours, and so yeah, it is not, in assessing whether there is a real problem. because people come and say all kinds of subjective things. It's important to, again, for insomnia, one of the important distinctions there is with associated daytime consequences, because I mean, people will come and say all kinds of things, but it's not affecting their lives, in practical lives, in any way. So and then yes, there are the occasional difficult psychological ones that, you know, at a certain point in time you tell them, look, you know, and they are the ones that we would recommend for a sleep study in insomnia, because the person comes how many times and says, okay, let's do the study, and then you show them, okay, this is actually what is happening, this is the percentage of REM, this is the percentage of, and so you are really within normal range. So I'm just to say that, without taking away from the point that yes, you have a complaint and you are mentioning something, but how has that impacted on your life, or your functioning? And it's not a matter of then saying them because you should wait. No, that's not. But whatever complaint or whatever assessment that is made should be made in its entirety in relation to other aspects of your life.
Okay.
Yes, Nana. Let me add on this. Yes.
Okay.
There are some people who are unable to sleep or do not sleep, and they wake up with as much energy as any other. Remember that we said sometimes mental disorders are related to some of these situations where you cannot sleep. So the person who can't sleep and becomes non-functional versus the one who is unable to sleep but is more full of energy than the one who slept, there could still be a problem underlining this. So somebody who has bipolar disorder, for example, in the manic phase, is not sleeping, but it has too much vim. You know, that still says that something is the problem, and you do need attention, even though the person feels fine. Unfortunately, in that situation, that individual may not even see it necessary to go and seek help because they feel very functional. I know some people who have this disorder, and their best time is when they are manic, because the kind of things that they are able to do, it's amazing, and they enjoy that period. So it's not only that it's affecting your function in that negative sense, but you even recognize that 2 hours of sleep or an hour of sleep and still working and going on is a bit much. Bottom line, where you have any concern about the amount of sleep you are getting, the best thing to do is seek proper services. Go seek the expert service, let them assess and consider whether there is a problem or not. After all, there being no problem is also good information to have. You know, it doesn't always have to be broken first. So I don't know whether that answers you, but yes, you could be having 2 hours of sleep. 2 hours sleep is not the usual, it's not normal. Don't wait till it breaks you down first, because there could be other mental health issues, for example, that may account for your lack of sleep and still being able to function.
Yes. So if I can do just a quick follow-up. I've taken some of advice, like I use the gadget a lot. I also listen to radio a lot throughout the time. And sometimes I put it on when I have to sleep, I sleep. If I wake up, it's on, I still listen to it. So I'm sure all these things are contributing to the minimal sleep I have. So what I've decided now, I'm going to do away with some of the gadgets and stop listening to the radio at odd hours. And then after some time, I will assess myself. And then if it continues like that, then I'll say, is that the best thing to?
Excellent, excellent, great.
Thank you.
So all the best. I'm sure you would sleep.
Thank you.
At least you get a few more hours than I would. You get a few more hours than I would. But Dr. Dixon and Dr. Fojo, my advice is that you might have to increase the number of chairs in your waiting room because expecting more. Sarah.
Which facilities are they in case?
Oh boy. Now it's gotten personal, isn't it?
Daniel, we'll share that at the end of the program. We'll share that at the end of the program.
Thank you so much. Thank you so
Sarah,
much.
Sarah, you're on.
Okay. So good afternoon to everyone.
Afternoon, Sarah.
Okay, so I have a couple of questions, but before I start, I would want to share with you an experience.
Ask one.
Well, okay. So when we came, I'm at a funeral, but I retreated to come and listen to the program. And then whilst I was listening with my headsets, I drifted off to sleep and I woke up again. So I lost a bit of the presentation. I don't know what that means in terms of your presentation. Sleeping whilst listening to something from the phone. Let's say you are listening to an audio presentation or a song or a sermon or stuff like that. But I want to find out from you, can we accumulate sleep and sleep on a particular day? Let's say if you have sleep deficiency for, like, if today I slept 1 hour, tomorrow 2 hours, the next day, can I accumulate it and sleep all on Saturday? Because I can do that. I can sleep the whole day. I don't even want to get up to come and eat. I can sleep the whole day.
Oh, really?
And yes, I can. Sleep is my thing. Because Dr. Mankwata knows how stressed I am. I'm always busy during the weekdays, sometimes on Saturday. So when I get the chance, I sleep a lot. And then there's certain sleep influenced by the food we eat, because sometimes you eat at a particular time of the day and you realize you are feeling drowsy. And then an experience I had in school was that sometimes I could learn all night and I'm feeling sleepy during the exam. So I can even sleep, I can time myself to sleep for 10 minutes. And really, I will put my head down and sleep for 10 minutes. I don't know how I do it, but the 10 minutes elapse and I'll wake up and I'm sharp again. I can just write my exam. I don't know whether there's any scientific explanation to that. And would you suggest that
you managed to put in all your questions, huh?
That's a journalist for you. I can cram in all my 3 questions in one. So, I mean, would you propose that in certain countries, unlike certain countries where they have sleep period, like in the afternoon, there's a siesta period. I know Cote d'Ivoire does that, and some, I don't know whether China or
French
also do that.
French-speaking countries, yes.
They do that. So would you suggest that for us, so that people wouldn't have sleep problems? At least they know if they work a particular for some hours, they have mandatory sleep. They can go and sleep in their car or wherever they want.
Sarah's questions are many. Well, listening to whatever audio and falling asleep. You just said profession. I am sure that you run around quite a bit.
Yeah.
And you have also told us that for you, when you are tired, picking up on sleep is no wahala for you at all.
Yeah.
Whilst you were seated and serene, and I don't know whose voice, whether it was Dr. Fojo's voice or mine, it was able to lull you back to sleep.
No, but I think I listened to yours fully. I don't know who came after you.
So I didn't put you to sleep, but somehow you managed to sleep. Well, you may have gotten distracted a bit, and then just the feeling tired and the soothing effect of Dr. Fojo's voice is good enough to get you to sleep. It does happen. We are very different, Somebody would be in a room where there is an earth-moving machine, and that is all right, would push this person to sleep. We are different. Somebody to the slightest noise, even the rustling of paper, can wake another person up. So we are different in that sense. the issue of food and sleep, it is actually quite normal. When you take in a heavy meal, our body functions such that there is pooling of blood to areas where it's most needed. So when you have eaten that heavy meal, the blood is not cut off, but reduced to the brain, and then it's pooled in the gut area where it's needed most. And that's why it quickly puts you to sleep. We call it shunting of blood. The blood is shunted to that part that is best needed. And then the issue of siesta. Well, we all are entitled to, I think it's an hour's break in between work. Those of us who do formal work, you're given an hour, and within that hour, you're expected to eat some and then take a little rest. But with the way our cosmopolitan arrangement is, as in the example given, coming from Kaswa to the middle of town, really, where are you going to get to even lay your head or rest your back? It just has become impractical. Even if they gave us that time to go for siesta, people will still not be able to travel back home to go and rest and come back. So I do not know how feasible it is in our context. That's just my thoughts.
Yeah, just to add on to the discussion about the options with respect to siesta, the Francophone and the Spanish systems actually have a system where they start work, I think, a bit earlier, and then they break, and then they have a siesta, then they come back and work a bit later on. I think that I can't remember some of my research or whatever, or some reading that in terms of the cycle or the circadian cycle in humans, we actually have a dip to sleep around that time. And so they're actually just using that natural rhythm. Of course, we followed the Anglo-Saxon system where it's all about work, productivity, long hours. And so, yeah, maybe that's, I mean, in terms of the practicality as to people going and coming, that's another dynamic. But the honest truth is that, yes, there's some reasoning or there's some merit in that siesta period. And incidentally, the lady who was listening to us who fell asleep, I mean, we are what we call, this presentation is happening during what we call, is it a graveyard shift, where it's like either after lunch or whatever it is. And but I mean, we all know that when you go for seminars or when you go whatever, a significant number of people doze off. They doze off in around these times in these presentations. So yes, there is some merit in the French and Spanish system, but maybe we are too far gone to make that adjustment. I don't know.
All right, thank you very much for responding to that. Mr. Hanu.
Thank you very much, Doctor. And yes, thank you very much. And these are very wonderful presentations. So my question goes to any of our panelists. What happens to those times when we were kids and we were having problem with bedwetting? The bedwetting issue is so real. It's like you are standing somewhere and by the time you realize, I mean, you've wet yourself. And that coupled with wet dreams. I mean, what is the scientific basis? Because you get up and it's like, you've really had wet, I mean, something produced, up for you. And so I wanted to know what was the scientific basis under those phenomena. Thank you very much.
Well, then, Dr. Mfojo, you might add how sex also helps with sleep.
Okay, I think I will answer I'll answer the wet dreams part, and I think I'll leave the bedwetting part for Dr. Dixon. But I think I mentioned earlier on about what happens in non-REM sleep, and how, again, there's what we describe in medical terms as increased autonomic activity. That means it's almost like nervous system that's not directly underneath, and that's not directly within your control. Now that's something that happens naturally in what we call rapid eye movement sleep period, or REM sleep. And incidentally, again, yes, having wet dreams or normal erections is a healthy, normal thing in a normal male, and it's not anything to be embarrassed about at all. If anything, incidentally, again, if anything, one of the ways, before all gadgets and one of the simple ways of clinical assessment for diabetes was asking about early morning erections, because they are as natural and as normal as can be and should be. And it's just a part of the autonomic stimulation that's associated with REM sleep. I think I mentioned certain characteristics. It's like wakefulness. Incidentally, again, in REM sleep, our body behaves like a reptile. We are poikilothermic, so many things happen to us in sleep that we are not necessarily aware of. But normal erections is in fact, it's a healthy, good sign that, as they say in you day, so please. Yeah, it's a normal physiological thing that happens, and yes, it is normal.
All right, thank you. Dr. Dixon, would you like to add something with regards to bedwetting?
With regards to bedwetting, it's been shown that for some people, and bedwetting can be for various reasons, but for some people, the bedwetting would be primarily because in the stage 4 of sleep, they go into this deep and long stage 4 sleep, and they don't get the regular or normal interruptions that come within that cycle. And then this happens. So that could be one of the reasons, but there are various reasons why some people were bedwet, including diabetes that Dr. Mfojo mentioned, because the person the sugar is drawing out so much water into the bladder that whilst they are in deep sleep, they are not able to rouse themselves to go and empty the bladder, and you can have spillovers. But one of the related problems as far as the cycle of sleep is concerned is what I earlier mentioned. And I think one of his questions was, how does sex make you sleep? Well, sex is a form of exercise, isn't it?
Yes.
We've said exercise is good for sleep. And plus sex is very relaxing. So it is a relaxation technique, if you like. And once you are feeling relaxed, it's easier to go to sleep.
Yeah, and just to add on that, I mean, whether hormones or stuff that are released, whether during climax, I think, is it oxytocin and some of the endorphins, etc., are relaxant, and so they actually do then, and one would say, enhance or improve relaxation to sleep. Yeah.
All right. Thank you very much. I think Dr. Dixon and Dr. Mfojo, I have stolen much of your time already. There is one last person that I would want to ask, then we can call it Edith. Hello, Edith. Hello, Edith. Are you there?
Yes, I'm here.
Please, your question.
Yes, thank you very much for the opportunity. I'm a nursing mother, and ever since I started giving birth, my sleep hasn't been normal. It's always 31 hours, at most 2 hours. I want to know if it will ever normalize and how long could it take? Thank you very much.
All right.
Thank you very much.
Thank you.
Yeah, I just would like to ask, so are you still a nursing mother now?
Yes, please.
How old is the
baby?
the baby?
10 weeks. 10 weeks.
Okay.
Please, you are in for, and before then, when was the last one? When was
The
one
last
before?
one, 2016.
Okay.
That's 5 years ago.
5 years ago. So yeah, in the 10 weeks, you are in for a little bit of a shift, because the babies, like I think I explained in the presentation, that under 2 years, 50% of our sleep architecture structure is REM sleep. That's what allows the baby to wake up at any time, feed at any time, etc. So it's almost like an inbuilt mechanism to it helps with bonding, it helps with feeding. So please, it will take some, as long as you are whether breastfeeding, whatever, and it usually sleep usually normalizes when the baby normalizes, which is usually from almost 2 years. Yeah.
Okay.
All right. Thank you very much.
Thank you
Dr.
very
Dixon,
much.
would you like to add something?
Well, I think that Dr. Fojo has it. As mothers, and I get the feeling that your maternal instincts are extremely high. So, you know, you are asleep, but your ears are there. Is he waking? What? Usually this would happen to first-time mothers a lot. But as as you keep having more, you know that, oh, they don't die like that. You know, so you are a little more relaxed when you sleep. And when they grow older, also you get a little more relaxed. But I realize you have how many before this one? Two?
Two.
Have 2, and then this one 3.
Yes, 3 years, please.
Yes. So for a third-time mother who still can't tune down their that instinct, maybe therapy could help, you know, to allay some of your fears, because unconsciously there may be some fear. Maybe you've heard stories. For example, some mothers would hear a story about sudden death or caught death and so on. And so they are on edge, and all the time they would even wake up and go and touch the baby's nose, is he breathing and stuff like that. So if you're waking up multiple times doing this, definitely you are not going to be able to have any good sleep. At 10 months, they may not be waking up as often as when they were much younger. So think about it. If after a couple of months you are still tuned in this high, see a practitioner, talk therapy, and you won't be needing any medication, but exploring your fears and concerns, the reason why you're unable to relax, some of these could be addressed through cognitive behavioral therapy, and you realize that, voila, you are able to sleep so much better.
I just wanted to add that even just knowing that the baby's sleep only normalizes after a certain point, that information should be a lot to make you understand how come you're also tuned. You almost, as a mother or you are tuned to the response of the baby. So yeah, it's almost like taking care of each other.
Okay, thank you very much.
All right, thank you very much, Dr. Dixon and Dr. Ifujo. Before you wrap up with your final comments, can you share places of help, professional help that people can go to get some sort of assistance?
I'm sorry, I didn't get you the question.
Well, if people want to come to you for help,
Okay.
how can they find you? Where?
Okay. Well, let me say that thankfully there are many facilities, especially here in Accra, where you can get the services of a psychologist. So at Lekma, there are psychologists at Achimota Hospital, at Police Hospital, Accra Regional, which is Ridge Hospital, Kolebu Teaching Hospital, 37 Military Hospital, and even some private practices. I know Nyaho has and Dampong and so on. So there are many psychologists within these facilities. Myself, I work at the military hospital. Oh, and before I put a full stop on that, somebody sent me a personal note that it is sex that you get an orgasm that is relaxing, not one that leaves high and dry. So corrected.
Yes, that's actually, yeah, that's actually
yes.
true. That's actually true. Yeah. That's actually true. Yeah.
All right, great.
All right.
Yeah. For myself, I consult from the Legon Hospital, the old Legon University Hospital, usually on Wednesday afternoons. And yeah, so that's where. Other than that, so nowadays it's always possible to do stuff by the way we are communicating now. So by Zoom or yeah. So if there's that service definitely is also an option and available. Yeah.
All right. Thank you very much. I guess I know that after the program, you carry me behind closed doors. So I'm ready. But I would allow you to wrap up on all that we've discussed, then I can bring the program to an end. So starting with you, Dr. Dessen first. I mean, the strategies that we can do to help get an hour or two to our sleep and all that.
Right.
Can wrap it up.
Thank you very much. Well, again, thank you for inviting us to come and discuss these issues. I think leaving the table, we should remember that our sleep is absolutely important, and sometimes whatever you are being paid or whatever you think you're gaining, it is absolutely counterproductive to exchange your sleep for all sorts of things. It is all right that once in a while your sleep gets disrupted, but if it is the pattern, you may be paying dearly later. All the physical health problems that you could get, all the mental health problems that you could get, and even how that disrupts your social life, that should tell you that you need to take your sleep seriously. When you find that your sleep is getting disturbed and there are no obvious or seemingly obvious reasons to you, please love yourself enough to seek professional help, get properly assessed, and get the correct intervention that should come to you. So remember this as you go home. I'll leave the floor to Dr. Mfojo now.
Yeah, thank you very much. I just wanted to say again, as I mean, speaking as doctors, we should not be quick to just either write prescriptions or ask people to go on, because the advice, sleep is a normal activity that happens or should happen. Yes, everything, there are changes here and there, but we are too quick to either ask for someone to go and get a prescription or, so that would be the general advice. I mean, one would give, and knowing certain things, again, something like knowing that aging is associated with changes in sleep, etc. We should be more careful about how we either advise or dispense medications, etc. Yeah. Thank you very much.
Thank you very much. For me, it's our lifestyle, doing away with our phones, exercises, and all that. I mean, the experts have said it. Need I say more? They have said it. And we need to help ourselves with this sort of advice. A lot of you have asked for slides. Yes, we'll share the link. But I suggest that a couple of days, probably over the weekend, when you go to our website, our Facebook page, mental health Facebook page, you will find the link of this program there, and you can watch everything there. All right, so on this note, I would like to say a very big thank you to our panel members, both Dr. Dixon and Dr. Mfujo. I mean, you made this one very worthy of our time and very fruitful too. We've acquired so much knowledge from this. I mean, for me, I need to change my lifestyle. When the phone is off, it's off. Do a few more exercises. And according to Dr. Dixon, some good sex will also do. So we've had some good advice. And I want to say a very big thank you to you. And to all our participants, to thank you for staying with us all this while. We are doing it for ourselves, and I also want to say a very big thank you to you too. God willing, if we have good health and we have life, same time next month, we would have another program on a different topic with different experts. So have a good weekend and know that there is help out there. Look out for your family and friends, support them, help them when they need me, and have a nice weekend. Thank you very much. The program has ended.